In the article, Medical Students' Attitude Towards the COVID-19 Vaccine and Medical School Vaccine Education, a survey study published in 2024, Kella Vangsness and others mention a statistic in 2022 following the COVID-19 lockdown. About 60% of the United States population were fully vaccinated against the virus. The remaining 40% were mostly individuals that have some reservations about the vaccine or the validity of COVID-19 in general. I am a fully vaccinated individual, and in the future, I aspire to work in the healthcare field and improve education promoting vaccinations. As students, you are susceptible to many diseases and infections that are transmitted between people on campus, in classrooms, or in the dorms, which requires us to pay certain attention to our health and the health of those around us. In my speech, I will discuss the benefits to vaccinations and implementing vaccines in all public institutions and making them more accessible in all communities. I will also emphasize the importance of vaccine education and how it is necessary to encourage others to become vaccinated. Whether vaccinations cause more harm than good is a continuous debate, and it brings up topics that touch on the importance of public health and preventative care. The issues surrounding vaccines are multi-layered. Many individuals and communities are either unwilling to vaccinate or do not have access to vaccination offices or facilities. The public also has access to misinformation that can skew their perspective on the topic. For example, COVID 19 was a prominent virus throughout 2020. Kella Banksness and others also expressed in their journal article that despite the precautions such as social distancing, wearing a mask, and leaving home when absolutely necessary, regulating the infection and mortality rate was still difficult to manage. Moreover, Alian al-Rashidi and other authors are pharmacists in Saudi Arabia. In their journal article published in 2024, they mention that there are about 20 diseases that have corresponding vaccines. Vaccination hesitancy is a barrier that maximizes the vulnerability of these diseases to the population. However, pharmacists all across Saudi Arabia were able to recognize their influence in advocating and educating their communities. In 2019, they began further education for themselves in vaccine administration and immunization. While there are still not many pharmacists that promote this change, this is still a significant step in the right direction. Everyone has been affected by the COVID-19 virus, whether through contracting the virus themselves or through friends and family. Without implementing vaccines, the pandemic would have continued even longer, and the same would have happened with other readily transmittable diseases. Without interventions, more communities become vulnerable to preventable diseases. Education and increasing access will make the promotion of vaccines more seamless. Implementing access to vaccinations in all public schools and community centers will significantly aid the effort in improving herd immunity. Additionally, requiring vaccine education from high school level to college level classes will also benefit to ensure that students have all the knowledge necessary to make informed decisions about their own health. Giving everyone the same opportunity to obtain vaccinations makes them more willing to do so. Not many are willing to go out of their way to do something that is not mandatory. So, by offering more areas to get vaccinated, it will be viewed as more accessible. Regarding vaccine education, by giving individuals a chance to understand the purpose and how vaccines work, they may be more amenable to getting vaccinated. By meeting these expectations, more people and communities will contribute to the strengthening of herd immunity. Through vaccines, our population will continue to build up resistance to life-threatening diseases and at the same time protect those whose immune systems is unable to do the same. Janelle McIntosh and others are nurses associated with the College of Nursing located in Birmingham. In their research article, Effectiveness of Vaccination Education module for college freshmen, published in 2024, they discuss the importance of introducing vaccines in schools where communicable diseases are more easily spread. Throughout the day, students are constantly making contact with each other in close quarters as well, which is the prime environment for these diseases to spread. Vaccines have done much to keep the outbreaks at bay by including a module teaching students about the vaccines and why they are important to their health. A positive outlook on vaccines can be developed. Furthermore, I understand that simply trusting a vaccine is a difficult effort. John Romley Praduma Gautam and Niraj Sood have educations in public policy and economics, although John Romley as well has further education in pharmacy. In their article published in 2016, they highlight that many fears people have in regards to vaccines stem from their peers. They report that if there are more negative behaviors towards vaccines in a community, outside interventions to promote them become less effective. In this case, education on vaccinations can do much to show that it is the preferable course of action to get vaccinated than not to do so. In reality, we are faced with many diseases, and while vaccines are a beneficial mediator, without it being properly educated and open minded to the good vaccines can do for us, we will ultimately be putting our health and the health of others at risk. Jean-Pierre Michael is associated with the Medical University of Geneva, located in Switzerland, and his journal article emphasizes that there are many benefits of vaccines. Herd immunity is one of the main reasons that vaccinations are encouraged, as it is not only protects those who get vaccinated, but those who have compromised immune systems and cannot be vaccinated. For example, anti-pneumococcal disease is not only spread from person to person, but it can also be transmitted genetically. The vaccine for this disease is able to reduce the risk of both modes of transmission. In a case where vaccines are not advocated for, these diseases will spread at an alarming rate. This will result in a significant increase of infection and mortality rate. Contracting diseases can be easy as being in the same room as another individual with an illness, and a lot of illnesses vaccines aim to prevent are deadly or can have long term effects. By making everyone aware of the disease, its effects, and suggesting the vaccine as a course of action can make communities more willing to take the vaccine. Even explaining how vaccines work in general, what is in the vaccine, why it's beneficial, can help convince skeptics and those hesitant to get the vaccine. Overall, everyone is entitled to manage their health in the way they see fit. However, it's essential to give everyone a fair chance to do so. In this age of constant communication and social media, what we consume online heavily influences our understanding and perspective on certain topics. I urge you, as my audience, to seek out credible sources that include unbiased information on vaccines. Additionally, it is important to inform those who do not have access to these sources as well as direct them to trustworthy centers to get their vaccinations. Vaccine preventable diseases remain universal and recurring. However, vaccinations have the ability to significantly reduce our vulnerability to these diseases, strengthening herd immunity, and educating people about the effectiveness and benefits of vaccines is necessary to increase their trust and awareness while being understanding of their hesitancy. Without vaccines, diseases are now considered rare and would be more prevalent, making everyone more vulnerable to death and disease. Our world with vaccines is a world where we are more protected and where there is less fear and suffering regarding our health. Thank you.